Thank you very much, Dr. Irfan Motiwala, for your time. Dr. Irfan Motiwala, I would like this particular Unplugged stories to start with. Tell us something about yourself that we don't know about you much, that probably we didn't hear about it in social media, maybe in the news coverage, or maybe from your staff, or maybe, being working very closely with you, I'm not aware of it. So that would excite all of us, and maybe the most exciting part of the story, we can start with it here.
Sure, Vishy. It's a pleasure talking to you. I have always been a fairly good horse rider, and I have been into this since childhood when my father actually initiated me into it, and I have kept up with it. And even my children, they do very good riding. So we go for horse riding fairly frequently enough during the weekends.
That's something is very surprising. I thought you may be telling something about golfing or paragliding, or maybe you may have some private jet. But this horse riding is very exciting to me. Can you tell a little bit more about it? Where do you do it, and what kind of horse?
Yeah. See, initially, as a kid, myself and a few of my friends, we used to go for horse riding at this AP Riding Club in Hyderabad. It's no more there now. And some new people, they have established HPRC, Hyderabad Polo Riding Club, and that's very good. And that's where we go. And my eldest daughter is very good at riding. She's an excellent rider. And so we had a very good time, and we go for what you call country rides, and that's very satisfying, very, very good. You really enjoy that.
That's interesting.
It's like going very much into nature. And one more thing which I really like about the horse riding part, is that when you are riding, so you might feel some people are very strongly trying to control a horse, but it is something like when you're riding, it should be you are thinking and the horse is doing. You have to have so much of good connection with the horse, respecting it and understanding it, and then the horse understands you. And when you think something, and accordingly the horse also moves around. And that is the right way of horse riding.
Yeah, and horse is indeed a very smart animal.
It is.
So basically what you're trying to do is you're making him or her a buddy of yours.
Yes, very true.
And you're able to handle him or her.
Yes.
That's interesting. And is that the reason the horse riding keeps you very sharp and alert and 24/7 on job?
Yeah, probably. Yeah, it's very soothing. It's very soothes your nerves. You really feel good. And sometimes you get a challenging horse also, sometimes again handling it. So it's good.
I'm so glad that we got this story from you. I hope this is pretty unique for your fans. Dr. Irfan, I was going through your records. It says that you have done over 18,000 plus implants. You have treated over 1,000 plus international patients when it comes to the full mouth or permanent teeth in 3 days. And I have witnessed it also. Whenever I stop by in your center in Jubilee Hills, I get to see a lot of Americans, Europeans. Another day I happened to meet a couple of people from Australia whom I also came to know that they're known to in my circle. So my question to you is that how did you go about attracting or what they see in Dr. Irfan Motiwala, that Hyderabad Dr. Motiwala Center is the hub for international patients or tourists, I would say, who come for their full mouth implant, or you may correct it, is it for the full mouth or they come for the cosmetic surgery?
Yes, Vishy. See, this is a long journey. And when I finished my master's in oral surgery, maxillofacial surgery, and for a year I worked in Kidwai Cancer Hospital, where I worked as a resident surgeon there. And I had good experience of assisting in major surgeries and doing most of the neck dissections and hemimandibulectomies there. So after that, I came back to Hyderabad and joined my dad's practice. And I was working during the daytime with him. And I was doing minor oral surgeries. And evenings, I was doing trauma cases for some hospitals. And in the clinic, I realized that many patients were coming to my father, and they were mostly NRIs who were looking for treatment, which is restricted to maybe fewer visits because they can't keep coming back and forth. And they were looking for quick solutions. So it was very natural for me to step into an area where, as per the demand, the treatment has to be in single visit and faster. So being driven by these factors throughout my career, I have somehow evolved into doing immediate implants. And this has again helped me in evolve and becoming better, because I stuck to this principle that the treatment has to be within a certain time frame and in a single visit. So keeping this as a criteria for my treatment throughout, I ended up actually also opening my own lab inside the clinic here. It's been 7 years now, and I'm happy we did that, because that also cuts down the time used. And so coming back to the implants, I started doing immediate implants, and I started doing implants in 2004. I picked up some different systems, and eventually I stuck to an implant system which was actually meant specifically for immediate loading, and it involved basically anchoring the basal bone, and which today we call it as basal implants. So this is how it was. And
But again, my question was more
yeah,
that why do I get to see so many international patients? In fact, sometimes I believe that if someone is doing a
Yes.
survey of where the American
Yes.
embassy or European embassy, I would
Yes.
say that it should be next to right and left of Dr. Irfan Motiwala
no,
Center.
thank you. No, all right. So see, basically, I missed that point. So what happened is, like, when our clinic was catering to the non-resident Indians visiting here for a certain purpose, for a short visit. So we kept evolving, and soon I realized that, and at that time I had an ambition of making a very good website, because I was doing this technique in a certain way, which was actually cutting down the visits and the time used for, by the patient. So when I made the website, I started getting patients, and soon my concentration went on tapping this source of flow of international patients. And that's how it kept evolving again. So this was another, the business part, I would say, of getting international patients. But actually it started with trying to do implants in a shorter frame of time. And eventually we found a market, and today those patients really appreciate, because in certain parts of the world, if the patient is having less bone, they have to go through a series of treatments, and in a span of almost a year, wherein first they go for extractions, then they wait for the healing of that socket, and then they go for sinus lift, and then again after 3 months again they go for placement of the implant, and again after 3 months they go for the placement, fixing of the bridge, the prosthesis. So altogether, all this would take almost something like 6 to 9 or maybe 12 months. And patients are frustrated with this, because they are not getting what you wanted, like immediate gratification.
So what I understood is that you worked on the pain area, wherein it takes from 1 week to 6 months, and you tried about solving that pain area. For that, you brought your own lab, then you started working on, and you are trying to see if that. But how did you go about minimizing from 6 months to 3 to 5 days?
Yeah.
That's something is very interesting.
Yes.
And I would be very happy in a very brief note if you can tell to the audience what does it mean by full mouth implant or permanent teeth in 3 days, so that they're able to connect better, maybe in a very pretty layman
Yes.
audience
Yes.
aspect.
Yeah. See, Vishy, what happened was, starting my lab, in-house lab, maybe was the last piece of the jigsaw puzzle.
Mhm.
But the initial part, as I would say, was this permanent teeth in 3 days. I had coined it almost 14 years back or 18 years back when was working on the website and I started that. So in those years, uh, we were struggling to do it in 3 days because of the lab
I see.
factor. Any more modification, it would go to the lab, then it would come back the next day. And that communication gap and the lack of interest in the lab because they are catering to 50 other dental clinics. So that was the thing. But sorry, your main question was
Help us to understand what is that permanent teeth in 3 days means, because
yes,
a lot of people would be curious to know.
correct. So how we are in that, would you basically what the conventional implantologists are doing is that they are placing first bone graft or sinus lift and then placing the implant and then the crown. So they are losing that much time. Now, in 2004, I was exposed to a single piece implant system amongst other various systems. And I realized this was a good system, and the father of immediate implantology, of modern immediate implantology, I would say, would be Dr. Stefani. I have great regards for him because he is my mentor. I have learned from him. So I quickly understood, that this is the system that I have to follow. And it was not difficult because it was difficult in those days because everybody would say this system fails because it was a bit more technique sensitive. So I pursued doing it, and I then went for an advanced course with Dr. Stefani to Europe, and where I had an opportunity to see him work and understand the concept of immediate implants. And it was a 10-day course, but it was a big eye opener for me because I was already doing it, so I could pick up those finer points. So when I came back, I was a full-fledged immediate implantologist after that. And in those years, and after that, I kept modifying because in those years, when I came back, they were at that time doing a metal bridge with a denture on it, a plastic denture on it. So it was called a hybrid bridge in those days. All right. And that would be later be replaced after 3 to 6 months with a porcelain fused to metal bridge. So after a certain time, I was giving only directly a porcelain, fused to metal bridge. So that's why I named that term permanent teeth in 3 days. The concept which I learned from Dr. Stefani is that you have to load the implants, or rather, in layman's term, put the bridge of crowns immediately within 3 days after placement of the implant.
So can I say that all the top teeth and the down, you get it fixed, and
upper and the lower together.
Upper and the lower end, lower, and the people are after 5-6 days they would be back to their normal life. They can go about chewing anything, or how much time it takes for them to come back to normal.
So Vishy, actually what you were asking me was the permanent teeth in 3 days. What exactly is it about? Right? So what I was saying is that when the patient comes, we assess the patient, and accordingly, if he needs a full mouth rehab with implants. So the day one would be once the surgery is posted. So on day one, we pull out the teeth in the lower jaw and put in implants in the lower jaw, and then pull out teeth in the upper jaw, put in the implants in the upper jaw, in the bone. And then we take impressions and register some measurements. And then we call the patient on day 2, wherein we do some trial, wherein we fix the bridge and check the fit, and we see how the patient feels about it, whether they want it to be the teeth to be slightly longer, shorter, or whatever, based on our experience and what their expectation is. And again, then we have on day 3 the fixing of the bridge, wherein whatever corrections that we had given to the lab, those corrections are done, and the lab is ready with the new bridge, and we fix it on day 3. Now, we give it as a range of day 3 to 5 earlier when we didn't have our own lab. Now, because we have our own lab, we are usually able to finish everything in 3 days.
So that's what in the beginning I told about. In the era of quick commerce, we have something like quick implants. Okay. So Dr. Irfan, when I was stepping into your office today, I heard something about BioSmile 3D.
Oh, yes.
Okay. Is that the new avatar of your permanent teeth in 3 days?
Yes.
And I'm sure that you're a pretty smart doctor. There should be a big story around it. So
Thank
can
you
you,
for- thank
would
you.
it be possible for you to share a more insight
Yes.
about it?
Yes. All right. See, we are always evolving. We are always growing and new materials are coming. So, as I told you earlier, that when I learned from Dr. Stephanie Day, his concept of fixing the teeth and bridges in 3 days, that was the principle in his strategic implant technique. So when I came back, then I modified it a little bit, and I was putting permanent teeth in 3 days, wherein I was putting a porcelain fused to metal bridge very soon, maybe after 6 months or a year later, after coming back. That was in 2007. Then very soon, zirconia came as a material, and it's a beautiful material. And in those days, we used to get zirconia only in white, so they had to coat it with a ceramic coating. But almost 8 years back, zirconia came wherein it was coming in whatever shades that we want, like A1 shade or B1 shade, things like that. That's when I realized that now I have to have my own lab so that I can do in zirconia. So, and 10 years back, I started doing, 10 or 12 years back, I started doing zirconia bridges instead of porcelain fused to metal. And it allowed us to, it gave us more leeway to do better work, because in porcelain fused to metal, the restorative space has to be bigger. So, and it ends up with teeth being bulkier. So zirconia is a beautiful material, and we are enjoying doing that. And so we coined a new term for it, BioSmile 3 days. Basically, it's BioSmile 3D.
Yeah.
And that's what it means, BioSmile in 3 days. And the immense advantages of zirconia, I mean, they are innumerable.
Yeah.
I don't want to keep mentioning them right now.
Probably when I was,
Yes.
might have graduated, during the school days, we heard about zirconia metal in the periodic table.
Yes.
I believe you're talking about the same part.
If you're talking about periodic table, let me tell you that zirconia is just below titanium.
Oh, so that's
And titanium is the most biocompatible element. And next is zirconia.
Oh, is that the reason why you went about using the word called BioSmile?
No, yes, you're right.
Wonderful.
Basically, let me tell you that they have also tried to make zirconia dental implants. There are some companies which are making it, but zirconia does not fit as a beautiful material for implant.
Okay.
But it is a great material for teeth.
For the aesthetic
aspect. Because aesthetically it is beautiful, can be worked upon very nicely, and it can be made by CAD/CAM. So lot of digitalization and reproducibility and mimicry or mimicking an adjacent tooth. So all that can be done with zirconia. And the most important part, the bio part that we have termed, is because when zirconia does not give a foreign body reaction. That's why they have also tried to tap it as a dental implant material. But it fails there in a certain way. I don't want to comment on that. But it's a beautiful material for restoring, beautiful material for crowns and bridges.
Indeed. Now, also, I look at your body language and your passion towards the material called zirconia.
Yeah.
I think that it's going to be
It's an exciting material, no doubt.
Yeah, I'm able to see that,
Yeah.
Well, thanks for it. And by looking at your talk and the discussion, I'm sure that the audience would be very curious to know, probably you might have started your dental practice, okay, starting with the basic implants. So can you tell that what kind of challenges you might have gone through maybe 2 decades back, probably when you might have started your practice? Because now you went about making your own brand, Okay, so now Dr. Irfan Motiwala, as per my better understanding, you're not just an implantologist, you're a brand, and today we are talking about BioSmile. Okay, and you have your certain process. I've had a tour of your center. You have a lot of state of art infrastructure. They go about manufacturing, designing, I would say. Okay, so can you tell me that this journey might have not been that easy? Okay, so can you just take us through now how the journey might have been 20 or maybe 25 years back when you started your practice, that part?
Yeah. See, in those initial years, because this is something like we are going against the flow.
Mm-hmm.
Today, anybody, when you talk about dental implants, it's a routine that tooth is pulled out, an implant is placed, and 3 months later you come back and we put the crown on it. If it's a single tooth. And something similar, wherein if it's a full mouth also, it may be something like that, wherein it is staged in that time frame. So convincing patients that it can be done in 3 days was initially a very difficult task for us. So, but already in those years, because I had already learned this technique from Dr. Stefanide of immediate loading and using basal implants. So already Europeans were kind of exposed to this kind of technique to an extent, because they could gather it from the web that this thing is happening. But in US, Australia, it was something like, we are at the top of the world and we are not doing it. What are you doing? What is this? They always had that apprehension that is this the right thing?
You mean that you mean the European dental doctors, American doctors are curious about what exactly you're doing it? That's what you mean, or about the
at that time there was not much literature also on that.
Right. So
okay, because Dr. Stefanide also was, as I would call him, that he revived this basal implantology.
Mm-hmm.
And Dr. Skottecki also. These two people, they are today's modern, but of course, they were at their prime 20 years back. And they had brought up this basal implantology against a flow of a current of tsunami of conventional implants.
True.
So right now, there are many practitioners who are doing it. But of course, they didn't evolve quickly into doing zirconia bridges and all. There are many who are still doing porcelain fused to metal bridges with the basal implants.
So that brings back to the question again, that what those European and American patients, they look at your center and they do come. Okay. Yeah. Is that the promise of delivering the smile in 3 to 5 days? Or is it the cost, or about the experience? Okay. Or restoring, I mean, I straight, these are the 3 points which are coming to my mind, because I'm sure that most of the people, they do come to India, maybe for the cost aspect. But what I get to hear is that you've got something very state of art, very modern, new, and which you are pioneer into it.
Yeah.
So is that the cost is the only reason they come, or you are the pioneer, that's what they came here?
One very important thing is, there's a niche wherein there are certain patients who are classified by the implantologist in their countries that we cannot do implants for you.
Mm-hmm.
Kind of a hopeless case.
Is it because of the country's regulation and compliance?
Yeah, that also is behind it. Because the bone is very less, so we cannot do. It's too risky for you, one. Or it is possible, we have to do bone graft and all that, which is exorbitant and time consuming. So this was a niche which was always very easily tappable, because this patient is a hopeless patient in their world. And they're always searching around, like alternative to sinus lift, things like that. So initially I started with those patients were coming initially. They said, okay, let's give a chance, let's give a try. And they started off, and now I have a complete spectrum wherein patients who are not treatable are also coming, lot of failure cases with the regular implants They come because once these conventional implants, when they get infected, they push the bone away, and very less bone is left. So again, doing a rehab for doing like a retreatment is difficult for again the conventional implantologist. So again, here again, we are getting those type of patients, and also we get some normal patient, means patients who have good bone, which everybody can do. So we enjoy doing that also.
So your hand is like a carpenter hand with an artistic output.
Yeah, I feel I'm blessed.
Okay, cool.
Completely blessed.
Very off track question. How have you insured your hand?
Never thought of that.
So I believe that it could be in a good business for those folks. And I'm sorry, stay blessed.
Yeah.
Okay, I'm sure that you have
Thanks.
brought thousands of people smile there.
Yeah.
Sure. Thanks. So, Dr. Irfan, again, when we look at your client pools, because I've been hearing it often from your team, they say that they are your clients who come, your patients, your clients who come from internet. So, what cases they are? Are there complex cases they come? Okay, in a layman language, if you can help us to understand how this cases looks like, and also you need to tell that how do people travel in such kind of complex cases, and what kind of services or solutions Dr. Motiwala Center provides?
Yeah. See, if you want to understand the spectrum of patients that come to us, as I had mentioned, that almost like 20-30% patients are really difficult patients.
So when you say really difficult, means all their top, down, teeth are full.
Difficulty only in the bone part.
Bone part. Okay.
Not their systemic condition.
Okay.
Systemic conditions can be handled by today every clinic. That's not an issue. Like they may be on blood thinners, or they may be having some systemically compromised condition that can be handled. It's not a big issue. But the main thing is the bone which is there should be there. If it is less, so that's when it can become challenging. So sometimes we also, in our basal implantology technique also, we may get something challenging, because since I'm doing zirconia bridges, if we are doing a metal bridge, it is less challenging, because you can put fewer implants with bigger spaces between them and put a very strong rigid metal bridge, and you can get away with it. But when you're doing zirconia bridge, you have to make sure that the span between two implants has to be less. That is what makes it challenging. So, but since 7-8 years I'm doing only zirconia. I don't want to do porcelain fused to metal bridge, because zirconia, with its innumerate advantages, cannot be compared with anything else.
So what I understood is that you have a kind of a checklist wherein you look at the bone strength of the patient,
bone volume.
Volume. If you find that to be adequate, then you ask them to fly to India.
No.
Then that's what I wanted to ask you, that how the process works.
Now, I don't think we have any elimination factor.
Okay.
In the sense that only if the bone has been resected completely, that's a different issue.
Okay.
Otherwise, all patients, they have a lot of pterygoid bone. Sorry, I'm getting into some terminology, but I think I have to get into it. So we anchor the last implant of the upper jaw. All the issues usually are in the upper jaw. Lower jaw is usually it's not a challenge. But upper jaw, because the bone is softer, and if the volume also is less, then still we have the pterygoid implant, which we can put very good anchorage, and the front implants in the canine pillars are great. So we still manage to put implants and give them a zirconia bridge.
Wonderful.
Yeah.
So then in that case, can you take us through one very complex case which you might have handled it and that's still there in your mind? Or could be a case which is, I'm sure you might have published it also.
Yes.
That you would like to share
recently. Sorry. Yeah.
So the most complex, or one of the very few complex cases which you feel like it's Dr. Irfan who blessed that person.
No.
I mean, you are able to handle it
successfully.
So
see, we have this patient who keeps coming us for recall, for checkup, because we always feel, we still hope he's fine. All right.
Yeah.
We also
So that
have
you're-
our, we also
you're at
have,
ease.
yeah, we have our, we know our limitations, right? So this patient was having ectodermal dysplasia.
What's that?
It is basically a kind of a condition wherein uh, the ectodermal appendages,
Mhm.
which are like maybe nails, hair, and teeth. Even
Extra.
teeth is from the skin.
Yeah.
Anyway,
Mhm.
so these can get compromised.
Mhm.
So this person, from childhood, he never had teeth coming into the jaws.
Oh, I see.
Okay, so he had what we call it is anodontia, means no teeth at all. So when the teeth are not there, the bone was also not developed.
Mhm.
The alveolar bone, in which the teeth are embedded into the sockets, the teeth never came out, so there was no stimulation for the bone to form in that way. So only that much bone is there where the muscles are attached, the true basal bone.
So, what was the age of this person, if I can
This
ask?
patient was 35,
Uh-huh.
and he was planning. He's in IT, smart guy, and he came with his father, and so he came to us, and we found that the bone is very thin, upper jaw, lower jaw. Even when we want to give him teeth, the tooth size has to be also very big, because suppose if I am smiling, you see the tip of my incisors.
Mhm.
Suppose if I have lost some bone, then this tooth which has to be restored will be longer inside till it touches the gum. So the height of the bridges has to be very high, long. It makes it very bulky, big. Otherwise, if we give small teeth, then his jaw will be overclosed because he's lost all that bone. And maybe I'm getting into too much details. But,
But what I understood is
these
you-
were the difficult points that we had to think about, and we did this case.
How's the patient condition?
We did almost 1.5, 2 years back.
How's the patient condition right now?
He's doing fine.
So-
we have periodic checks with him, and he comes every once in a year.
So, can
we
we
take
say
his
that one day
X-rays.
we can invite him also for this particular chat?
He was here today morning.
This morning?
Yeah,
How did I miss him?
yeah.
You should have told.
That's why I recollected.
Okay.
We took maybe I think they were going to take a video of him,
Okay, wonderful.
and we have published an article on him.
So I would be happy if we can also, share those documents and the evidences what Dr. Irfan was referring about right now. Sure, thank you. Dr. Irfan, by watching this particular unplugged stories of yours, I'm sure there may be some international patient who would like to avail your services. Okay, so can you tell us that if someone wants to avail your services listening to this particular unplugged story of yours, how they can get in touch with you and your team, and how the patient journey looks like?
Yeah, Vishit. See, this is basically usually patients, potential patients, they search on the web,
Mm-hmm.
and through Google they will look around, find the website. They usually fill the form there, and from there, my international coordinators, they will take over. They help and guide the patient. They ask the patient to send any recent records, dental records, any X-rays that they have, any photographs, and they guide them how to take some photographs. And so we gather information from them,
You mean the X-rays?
X-rays if they have any,
Mm-hmm.
and at least they can take some photographs, and then they can fill out some form as to actually what exactly are they looking for, whether they are looking for something like cosmetic treatment, or they're looking for some functional treatment or replacement of some missing teeth or full mouth implants. There's a small questionnaire which once they answer, based on that and the photographs that they send, at least a basic kind of info we get from the patient, and based on that we give some kind of a treatment plan, and we give some guidance to the patients through the international coordinators. And once they get that idea, it is always a little flexible, because we are not seeing the patient live here in the clinic. So once the patient is kind of okay with that kind of treatment plan, then the coordinators, they set up the dates, and accordingly, once the patient comes here, the patient is picked up from the airport.
But before that, does a teleconsultation something takes place?
Yes, some patients need that. Some patients, and again, I would say like 30% to maybe sometimes, I don't know, 30-50% patients are by word of mouth. So they have already had some friend or relative treated by us, and 8 years, 10 years back, and they still have good words about for us. So these patients, they come in complete faith, and they're open to being a little flexible. And that is what is easier for us to treat, because they come with a very open mind.
So you have your entire team in place who will take care of their legal aspect, their visa aspect,
Yes.
your pickup, drop, everything, like a
Yes.
full-fledged.
Yes.
Okay,
Yes.
wonderful.
They are picked up from the hotel, I mean
Mhm.
from the airport, and dropped at the hotel. We have some kind of a tie-up with some hotels wherein they can give some value-added services to the patients,
Such as?
because they are staying for something like 10 days, 12 days. Earlier, we used to tell the patients for 14 days. Nowadays, 10, 12 days is enough. Though the treatment is for 3 days, we want some buffering. The patients are traveling and they are coming from a different time zone. They need time to recuperate, become a little fresh, have good sleep. So we don't start on day one. And again, we want to finish the treatment and the patient coming to us for at least 2-3 times and feeling, yes, I'm fine, comfortable, I'm ready to go.
To add on, I remember when interacting with one of your team member, you also have a nutritionist, a nutrition plan with them. They
yes.
get in touch with the hoteliers. What's that like? That was pretty interesting, because everyone's food habit is different, especially with the international patients.
Yeah, some patients, we are restricting the patient's diet. We're telling them to chew soft, I mean, not chew, but be on soft diet. And every patient is coming from a different culture with different, diet. And so the chef, our coordinators, they have good relations with the hotel. So they make sure that the chef comes to the patient and checks out what exactly would they like, and accordingly make things which are soft and easily palatable for the patients.
Interesting. So you also mentioned about cultural aspect. You take care of the cultural sensitivity of the people. That's what you meant here.
Yeah. See, I mean, the chef can because it's like multi cuisine. Most of the hotels that the patients stay in.
Okay, that's more to do with the nutrition aspect.
Yeah.
And Dr. Irfan, since this particular Unplugged story started, and probably when I was more focused towards international patients, and everything looks in your center 5-star, and the chef, customized nutrition plan. I'm just wondering that a common person like me, Bharatiya, Janta like me, can they avail your service, or you're very premium, or it's like we need everything to pay in dollars?
No, I think you're mistaken.
And I'm sure that all the folks who are listening to it, that's a question which should be coming. And I don't want to be very candid and ask you that, can me and my family can avail your service without we asking you for discount? I'm sure that if I asked you, you would be giving.
See, let me tell you, we are staying in a domain, and there's competition everywhere. So we have to match certain kind of competitive pricing. We cannot be exorbitant, firstly, as a general rule. Then, if you are thinking about international patients, they are treated on a fast track mode.
Fast track.
Okay. Because they are coming for a limited time period. They are leaving behind their job days. So they are sacrificing some days at their job. They're coming here. Then again, they have to pay for the hotel. So all these things are added.
And also they would be coming with one of their family members.
Yes, usually, some people do. Like 50% patients, they come with some friend or family member. So they are paying, so it's like race against time. So we have to make sure that the time is really utilized. And so for that, we take some measures. And based on that, we have some little difference in pricing. Otherwise, so for patients who are not coming from overseas, like what you have mentioned, so you're always welcome, and the pricing is very reasonable, and it's hardly much of a difference. But that pricing is because of the fast track mode that we try to do for them.
That's pretty interesting and smart. So what I understand is that you don't have any biasness with respect to international patient or any clients. So if they're paying a premium, it's because of the fast track. Probably you're reserving certain services and time for that one.
I'm biased.
Okay.
I like difficult cases.
Okay.
That's all. So it comes from anywhere.
Okay.
That is what will keep us going. Otherwise, but there are many cases which are monotonous.
Mhm.
So you enjoy and you really think and you want to really plan well and want to make sure that this thing works. So if you're saying biased and unbiased, this is where I'm biased.
Okay. Well, like now, one more thing, I don't know, probably I may be the first person to leak it. So I do keep coming to your center. I saw a certain set of consultants in your company. Are you going for something like JCI accreditation, something?
Yes, we are trying to work on it.
Congratulations.
Yeah, thank you.
When is it?
It's not easy. Basically, you have to make sure that everything is, error proof, because you cannot. That is all. It's all about that. Basically, we have always been into it, but we never realized when we started working on this JCI, it goes to very finer details, and actually it is awakening us in certain areas, and it's good for us.
It's good for the whole process.
It's not just the accreditation that we are now, I think, is more important, but actually it's important that it's going to raise
set up your own standards.
Yes.
And if I'm not wrong, probably would this be a first dental center in India to have it, or I'm not aware of it. I heard about
probably. I'm not really sure. I would be surprised. I mean, I was surprised that I was told that by a person who's helping a consultancy company who's helping me out in streamlining this thing. So they said that there's no dental clinic, but I didn't go and verify it. I believe them.
But I must congratulate you, because JCI, whatever the experience I have in the healthcare industry, it does give a good assurance especially from the American and the European market. Okay, and I must congratulate, and so look forward for that day.
Sure.
Maybe I would again come back.
Always welcome.
Sure. Thank you.
Thank you.
So, Dr. Irfan, we were talking about JCI, okay, accreditation, setting up standard. So overall, it's all about the best practices, okay? And I'm sure that you've been working with varied kind of international clients, international patients, also many Indian celebrities and renowned person I've seen. So when working with them, I would like to know you as a doctor, okay? A doctor who is giving them a hope of bringing back the smile. What has your learning been from them? Is there any learning you get?
Yeah, you see, I get to interact with them. So after I have given the local anesthetic, I usually wait for 5 to 10 minutes before I start the work, and I'm hanging around there only with the patient. That's the time when I actually start talking, because all the treatment plan, everything was discussed earlier. So I start discussing with them, where do they come from, which city are they from, how is that city, and some of them have very interesting names. I ask them, what does it mean? And I find this world is so beautiful, with beautiful people. And it's a great learning experience to know so many different cultures, different people. And actually, this is also something that really I enjoy. And I feel I'm lucky I'm able to enjoy this. And I would always, at the end, my goal is that when these lovely people go back to their home, they should remember us as very good people, and they should remember clinic, our dedicated team, and our country. It should be etched in their hearts.
You meant our country?
Yes.
Wonderful. What a thought process. So that's there in every thought process, every delivery you're delivering it.
Yes, because they are coming all the way from their country. I can see them. They are patients who are in their 60s, 70s, 80s. And sometimes I really am surprised at their fitness, and they are so much interested and motivated to come. They're staying in a hotel and they get treatment done. They go back to the hotel. So we have a team, of course, to take care of all these things, but they're coming all the way here.
Interesting.
I want them to go back with that good feeling from India.
India. Good feeling from India. The most of the folks may not be knowing that I consider you to be a champion when it comes to the keyword called medical tourism or dental tourism. Okay. And now I am able to understand that why you are successful with some other aspects. Like your core value is that when the people go back, they are not just restoring their smile, also the good thing about the country. Okay. And that's really appreciated. Okay. Thank you, sir.
Thank you.
Jai Hind. This particular section, I'll be calling it as Beyond Dentistry. Okay, so I'll be having some series of questions which I would be asking you, Dr. Irfan, and so that we get to know more about you. So my first question, my favorite question which I ask to everyone, if you were not a dentist, what you might have been? Horse rider?
Yeah, maybe.
Because we didn't know about that horse rider.
Because I've been doing it since childhood. Yeah, maybe.
So
difficult to say.
Sure. Dr. Irfan, what has been the most memorable trip or an adventure you might have done in your life that you can share with us, other than horse riding?
Other than horse riding. I had once gone for fishing with my friend. He told me, let's go for fishing. And I went with him. I'm generally an outdoor person and like to get into such activities. So a long lost friend once met me at a wedding and he said, I'm going for fishing. You want to come? I said, let's go. So he took me for the trip and he brought a gun with him. And then we went late in the evening. We drove for 2-3 hours. And then he had a team there already ready for him. And then they were putting light in the water. And when they see a snakehead marl fish, he would shoot just near it and it would get shocked and the boys would jump into that deep water in the night and pick it up. And very soon after this kind of exercise, we went to then another dam and then another dam. And then one dam, he said, now we have to wade through this water. And it's like midline and it was actually 31st December.
I hope your friend was not drunk.
No.
His aim was good, right?
Yeah. So then we waded through the water and we were like this and we are walking through that and we saw a pair of eyes. So I said, what is that? And he said, that's a crocodile. I said, what? And he said, yes, don't worry, it will not do anything. And I said, what? So and finally we crossed it and he went on with that. And it was a fishing trip which was very odd, very unique, and a great experience. I can't forget that ever.
Amazing.
Yes.
Was it in India or abroad?
It's in India.
It's in India. Okay, sure. So, Dr. Irfan, so now since you mentioned about reading, what are the 2 books or 3 books that you would recommend your audience, your fans to read, which you have been inspired with, other than anything from dentistry?
Yeah. See, basically, I read mostly the newspaper. I'm more interested in current affairs. And this is what my reading is about.
So, can we have a quick chat about the geopolitical?
Oh.
Okay. So, we'll skip this question.
It's a big topic.
It's a quick question. Okay. So, Dr. Irfan, a question to you is that if a movie has to be made on you, okay, which actor do you think would be the right cast for Dr. Irfan?
Well, I never thought of this.
Let's think.
It makes very difficult questions. Difficult than the full mouth implant.
Okay. So my friend Santosh, what do you think? Which actor he would be good at? Okay, by the way, Santosh is our colleague and he's behind the camera. So which one do you think? So Dr. Irfan, you heard.
Thank you so much for those thoughts. Okay, I never thought on these terms at all, ever.
And that's what the series is all about, the rapid
Okay.
fire.
Yes, yes.
Okay, so the audiences, in fact, if you couldn't hear what Santosh was saying, he would like to cast Amir Khan Sahab in the role of Dr. Irfan Motiwala. Okay, so the next question to you would be, if your life had a background score, which song would it be?
I think that
So I'm going to you record it again.
नहीं, वो
huh?
good, the bad, the ugly.
Hmm?
For a few dollars more sounds bad. Though it's good.
Hmm.
Music is good.
So
उसकी
what,
भी दोनों की भी similar है थोड़े वैसे टाइप की है ना.
how?
Good, the bad. I can't differentiate now which is which.
So which one would you like to say?
The good, the bad, the ugly.
But, so we are going to say
हाँ,
that.
वही था ना उसका भी था ना. देख लो.
देख लीजिए.
हाँ देख लेना. ऐसी चीज
Off कर लो.
क्योंकि जो है अपन.
So Dr. Irfan, one quick question. If your life had,
I think that
so I'm going to you record it
नहीं,
again.
वो
huh?
good, the bad, the ugly.
Hmm?
For a few dollars more sounds bad. Though it's good.
Hmm.
Music is good.
So what,
उसकी भी दोनों की भी similar है थोड़े वैसे टाइप की है ना.
how?
Good, the bad. I can't differentiate now which is which.
So which one would you like to say?
The good, the bad, the ugly.
But, so we are going to say
हाँ,
that.
वही था ना उसका भी था ना. देख लो.
देख लीजिए.
हाँ देख लेना. ऐसी चीज
Off कर लो.
क्योंकि जो है अपन I enjoy that. When I'm traveling, I make sure I'm enjoying their regular local foods,
So what's your,
and that will end up being on the street as well as the fine dining.
okay? What's your favorite street food other than vada pav?
Okay, that pani puri thing.
Okay.
Okay,
So you say that you have pani puri in Hyderabad.
yes.
Okay. What's your favorite adda here?
This Balaji Grand Bazaar is there.
Okay. Cool.
Yeah.
So I like it.
And Haji Ali is there.
Okay. Where's this Haji Ali in Hyderabad?
Haji Ali is road number 7.
Okay. Interesting. And I'm glad that you like pani puri.
Yeah,
Sure.
we grew up having these things.
Okay.
Yeah.
Sure. Thanks. Okay. So now let's couple of final question. I understand that you are more an outdoor person. I'm very curious to know. Let's go back 4 years back. What were you doing during COVID, when everything was shut off? International travelers were not there, and I'm sure. Sorry, your business might have been little slow. Okay. What were you doing during the COVID time?
That was the best time of my life. I felt blessed actually because I was not guilty. The flights are closed, nobody can come, and it was for 2 years almost like that. So I would come to the clinic just for an hour or two, once in 2 days, 3 days, for just some treatment, and then go back. And that's the time when I kept some horses at my my farmhouse, and every day, because of the shutdowns that we had here. So in between the shutdowns, we used to go with the family, go for riding and come back. And my outdoor excursions became more elaborate. I bought one Thar, a Jeep,
Mahindra Thar.
Mahindra Thar.
I think that's the
So-
time wherein they launched the new Thar.
Yes.
Is
So
that
then
the
I
new
was
Thar?
going out. Yes. Then I was going out for off-roading, and I was going for fishing with friends.
So would it be possible for you to share some of your pictures in Thar with your horses? Because we always have seen in your either your clinical attire or this attire.
Sure, definitely.
So that would, because most of the time either we are talking
Yes.
about the horses,
Yes.
the fishing. Okay, good.
Sure.
So, well, thank you very much. Well, Dr. Irfan, these are some questions which I got it from my team. They were asking me to ask from you and to understand your perspective. It may be a bit, we need a very different thought process to look at this particular question, especially the following question, which I would be asking you. My first question to you would be that why should medical doctors refer their patients with missing teeth, some kind of infections, having a chronic conditions for the dental implant for the experts like you? Okay. And followed by that, I would also like to understand that how do you ensure the best outcomes has been given to their patients who come with such kind of chronic conditions, or maybe with a severe bone loss, having diabetes? Okay.
Yeah. See, for the overall health of the patient, they should be having proper chewing capacity, potential to chew properly. So if the chewing capacity is compromised, the patients, they end up swallowing foods which are almost like big particles, and that is what causes most other systemic problems like flatulence and
Got it.
indigestion and other issues. So that is one thing. Secondly, if the patients are because in diabetes they are telling the patient to shift to more roughage, so then again they need to have those tools, the proper teeth for that kind of diet. Otherwise, what happens for many patients who have improper teeth and less number of teeth for chewing food, and they end up eating more of rice or softer foods which are more carbohydrate rich, and again that is going against the way the diabetologist would want the diabetes to be controlled. So it becomes an uphill task for them. Maybe there should be some collaboration between the diabetic specialist and dental surgeons, so that this kind of problem is sorted out. Secondly, in many medical conditions where some patients are, if the patient is supposed to expected to undergo some kind of a surgery, and it could be debilitating for some time. So that's the time when actually during the pre-anesthetic checkup, and it should be well planned prior to it, so that thorough checkup is done of the teeth, and the oral hygiene is very good, because once the patient is hospitalized and is recuperating from the surgery, their oral hygiene can deteriorate further, and that will cause their gums to get inflamed and problems with the gums, and the cavities can form. So proper oral hygiene and detecting any teeth which are really bad should be eliminated, because once the patient is sick, is recuperating in the post-op, and then they have pain in the teeth and all that time it is more difficult to treat the patient. So preemptive, that patient should be treated, even if it is some minor things at least, before they can go for any major kind of surgical interventions in any field.
So, is there any kind of initiative, or is there any kind of such awareness program? I don't know how to put it. Would it be a continuing dental education or continuing medical collaborative education? Is there anything you are doing it, or are you aware of it?
No.
Since you emphasize there needs to be a collaboration.
See,
Or-
I have a few.
or is it-
I have a few set of friends who are into medical fraternity, and they do send patients, but on a proper scale, we are not doing this kind of work.
So that brings on a very interesting question, which is always there in my mind. Do you think there's a need of interdisciplinary collaboration
Yes.
between people from the dentistry, the surgeons, the medical fraternity? Okay. Do you think an interdisciplinary collaboration is required? And if yes, and what stage it should be there? It should be during their schools, the medical schools or the dental schools, or is there any kind of a joint programs? Are you aware of it, or what's your thought process? And I would like you to put a little bit more emphasis here, because that's something which I keep thinking.
Yes, there is a lot of scope, because this is for the overall health of the patient.
Yes.
If we are looking at that from that perspective, because we have to do full justice to the patient. So there are some in our initial schooling, medical schooling, we are taught about these, but somehow in implementation stage, all the faculties, they are falling short in that. There should be a bit more coordination. Probably, I don't know how it should be done. Maybe that's where
I'm just
your role comes in. Maybe
that's what I'm
wherein-
thinking. We all keep
Yes.
saying about mental well-being, social well-being,
Yes.
emotional well-being. Why we are missing
It should be
dental well-being?
it should be a very well knit and properly formed system.
No, I think you missed it. I'm saying we heard about mental well-being, we heard about social well-being, we thought about emotional well-being, we talk about financial well-being. There's also why we should also include another keyword called dental well-being,
Yes,
because
yes.
everything starts with your chewing. That's
Yes,
what I
yes,
understood.
Definitely. It should be added, and I mean, that should be a part of the, dental checkups should also be a part of the in pre-anesthetic checkup. But but I see that in some hospitals it is being done.
Yes, I'm aware of
Yes.
it. Yeah. Sure.
Yeah.
Well, thank you very much. Well, now we are coming towards the end of Unplugged Stories with Dr. Irfan Motiwala. And Dr. Irfan Motiwala, a question which is very much to my heart because I heard, and I'm witnessing that you've always been in a benchmark. You've been a pioneer. Okay. So my question to you, and with this we'll end this particular conversation. What is the next for you? What are the upcoming research projects or a kind of an innovation? What's new? What is next for at Dr. Irfan or at Motiwala Dental Center?
Vishy, see, primarily we are trying to first streamline our process.
Mhm.
So in admin, we are trying to get JCI so that our admin is strong, so that it is completely error free, and we are confidently, shifting the process to the next specialist so that everything is more streamlined and we don't lose time there. And at the same time, we are trying to build some leaders in our system
Mhm.
who can work more independently, and that would allow us to build up the capacity more to treat more deserving patients. And one area that we have been working for since several years, and it's little difficult, is that there are some areas which are not yet digitalized for basal implants.
Mhm.
And we have been working on it on and off, but our aim is to work on it and actually make it into a complete digitalized solution, and what people today call it as smart, making it a smart technique. So this is what we feel we are trying to do.
And I also get to see you're writing a lot of manuscripts. You have
Yeah.
thousands of
Yeah.
cases. So
Yeah, we have a system of publishing what all interesting cases we do, and any little improvisations that we do, we keep writing them in the journal. So we have some articles.
And by looking at this particular series, if anyone wants to be your Sishya
Yeah.
or someone wants to join you, like do you offer some kind of a fellowship
Yes,
program?
yes. Maybe we soon have some fellowship programs.
Mhm.
That is also in the pipeline, but right now it's a little away. Maybe several months from now, but soon we'll be having that.
I wish
That,
you a
that
great
only
luck.
will allow us to basically build the capacity.
I wish you a great luck because so that there can be another Dr. Irfan Motiwala. He can tell that I learned from the way you learned from your guru. I'm sorry, what's his name? Steve.
Dr. Stephanie.
Dr. Stephanie. Okay. So you must look into it so that you can make many more Dr. Irfan Motiwala. Okay. So it was indeed a great conversation with you, Dr. Irfan. And I look forward you become the India's first smart dental implant center. That's what it looks very ambitious. But I've seen that, you've been walking your talk. So look forward. So my request is that when you become the first smart implant dental center, let me write the case study. Okay.
Thank you
That's
so
my bread and butter.
Thank you.
Thank you very much and wish you a great luck, sir. Thank you very much.
Thank
Okay.
you.
Okay. So thank you very much, all of us. I mean, the team which has been here. And with this, we will be unplugging the Unplugged series. So we have a style of saying like this, unplug, you may do it. You can just unplug it.
Okay.
Okay. Unplugged. Thank you very much.
Thank you.